Okay, Nicole Mashburn, going to talk more about the bones, doing some more bone labs. We're going to move on today and do the pectoral girdle and the arms. So hopefully you're kind of following along in order and you've done the cranium, you've done the facial bones, you've done the ribs, you've done the vertebra, and now we're going to do the arms and then we'll do the legs. So let me get this started. There we go. Okay, so we're going to do the pectoral girdle. You've talked about your pectoral region. You exercise, you're going to get your pecs big, it's kind of your big chest muscles. So your pectoral girdle is kind of your chest. It's how you hold your arms onto your chest. Basically, a girdle is something that holds you in. Okay, so what your pectoral girdle does is hold your arms on. So your pectoral girdle is basically your shoulder and your clavicle. And then your appendages, your upper arm, your upper appendages, or your upper limb is your upper arm, and then this part, and then your hand. And we're going to name these bones and all these bones as we move along. So let's go ahead and talk about what makes up the actual pectoral girdle. The pectoral girdle is a clavicle and a scapula. So you have a clavicle on each side and a scapula on each side. So the clavicle we call our collarbone. So that's what's fallen and broken their collarbone. They actually broke their clavicle. And then on the back side, your shoulder blade. In front of your shoulder blade, that's your scapula. So from here on out, we're not going to use collarbone or shoulder blade anymore. We're going to use clavicle and scapula. So on the exam, don't look for collarbone and shoulder blade. You got to know clavicle and scapula. And the main thing that these do, they are attachment points. They attach your upper limb to your axial skeleton, so to your thorax. And then they also provide attachment points for muscles so that you can move your arms. In order for you to raise your arm or twist your arm or do anything like that, there has to be some kind of a muscle that attaches to your arm and up to your shoulder so that you can raise your arm. So these are all attachment points. Usually when we're going to talk about bones and bone features, a lot of those features are actually attachment points, or again, they might be where the two bones come together, make a joint where they articulate. So I'm going to point out different features to you so that you can recognize these different bone features. Now, what I want you to notice right here, this is the top of the humerus, which is your upper arm bone. This is your scapula. And that forms a ball and socket joint. And so when we talk about joints in the next section, you're going to see that you have different types of joints, and one of them is called a ball and socket joint. So you have this ball here, and it fits into a socket. It's freely movable. You can go just about any direction with your shoulders. So that's one of the reasons your shoulders are so important. It gives you a lot of mobility in your arms. You also have one in your hip. Not quite as movable as your shoulder, unless you're maybe a gymnast and can touch the top of your head with your foot. But for most of us, our shoulders are more flexible than our hips. But it's because of this particular setup here. Remember, form follows function. So the function is to be able to, spin your arm around and round. You need the form of it to be an open space that allows you to do that, or a ball and socket. All right, so let's kind of go over some different features on the clavicle. There's not really a whole lot to it. It's kind of an S-shaped bone. Basically, you need to recognize the sternal end versus the acromial end. Remember, acromial means shoulder region, so out here on the end of your shoulders. Sternal is your breastbone. So the flat end is the sternal end, and the curved end is the acromial end. So if you see a picture of a real bone, look for the flat end. That's the sternal end, and this is the acromial end. And that's really all there is to know about the clavicle. The scapula is a little more complicated. You have to be able to figure out what's the front of the scapula, what's the back of the scapula, what's the medial side, what's the lateral side. So when you're looking at a scapula, this is actually a right one. Look for this ridge. It's called the spine. So if you look on your, I've got, we're going to name a few of these. All these on this page are what you don't have to know. I'm just going to name the ones you have to know. Look for the spine. All right, well, the spine is always going to be on the most posterior side of the scapula. Because think about it, when you move, your shoulder blades move with you, right? If this was facing the front, that spine would click, 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 click on your ribs, and that would be uncool. That wouldn't work. So your spine of your scapula is on the very, very back. Okay. Well, looking at this, we know this is where the ball and socket is. All right. We know our humerus has to hang off this side. Okay. Well, this has to be on the right side, because if this was my body, okay, the humerus has to be hanging off over here. If I tried to hang the humerus off on this side, my humerus would be hanging off in the middle of my back. So find the spine, make that the most posterior side, look for the ball and socket, that little cavity, so that you can hang your humerus off of it, and that'll tell you if it's a left or right. So this one happens to be a right. So once you have your orientation, and this is the back, then if your humerus is over here hanging off of it, this must be the lateral side. That means it's away from your midline. That must mean this is the medial side. So you have your medial and your lateral margins. So your spine's on your dorsal surface. This cavity, where I've been telling you the socket is, the part that where the humerus connects to, we call that the glenoid cavity. And then there's two little processes that kind of make the rest of that ball and socket joint. The acromion and the coracoid process. And coracoid kind of means hook, and it's kind of a hook-like process. The acromion is on the posterior side, and the coracoid process is on the anterior side. So let's look at a real scapula so that you can kind of see what I'm talking about. So let's look at this one. This is a real scapula. I've kind of held it up in three different directions looking at it. Here's that spine, okay? So the spine is on the what side? It's on the back, okay? Does my humerus hang off over here? No. Hangs off on this side. So this is obviously a left scapula, okay? Because this is the back, the humerus hangs off on this side. So this would be my lateral margin, my medial margin, my acromion, and my coracoid process. You can really see the acromion here and the coracoid process here. This is the coracoid, and this is the acromion. And then here is your glenoid cavity or glenoid fossa. Cavity or fossa, either one is correct. So look at these real bones. There are some review exercises in your blackboard so that you can recognize these bones using real bones. Alright, so coming off the pectoral girdle, you've got your humerus. That's your top bone. Isn't that funny? It's kind of humerus. But there's no O. Make sure you don't spell it humerus. Here's your humerus. It's a long bone. It's longer than it is wide. Okay? You need to know the proximal end and the distal end. So the first thing you got to do is figure out how it goes in the body. Well, here's that ball. We know the ball is up here by the shoulder. This is proximal or distal. Proximal means it's closest to the chunk of the body. So this is your proximal end. This is your distal end. So we know our orientation. This one is a right humerus. And the way I know that is, number one, I know this is my proximal side. And I know this is the ball of my humerus. Well, the ball has to face inward, right? Got to face inward so that you can go to the ball and socket. But I don't know. Does it go this way or this way? How do I know? Well, the way you know the front from the back of the humerus is look at the bottom. If you see a kind of a fossa or a big depression, that's called the olecranon fossa. That always goes in the back. So that's the posterior side. So you're looking at the back of this humerus. On the other side, you have what's called the capitulum and the trochlea. And these are where the radius and the ulna actually join the humerus, the two bones of your lower arm. So the things you have to find, so you have your long bone, so this long part is called the diaphysis. The ends of your bone are called the epiphysis. You hopefully learned that. We talked about bone formation. This rounded area is called the head. You have the capitulum, which is this little round head. You have the trochlea, which looks like a spool of thread turned on its side. You can see it here, here. You have the olecranon fossa, which is the big fossa in the front. And there's a smaller on the back. There's a smaller fossa on the front, on the anterior side. That's called the coronoid fossa. And I'll show you how how the radius and ulna fit into those two fossas as we move along. So those are the ones you have to know. Coronoid fossa, olecranon fossa, head, and then you need to know the capitulum, the trochlea, and the medial and lateral epicondyles. So these and these. Condyle is the rocker. Remember, that's what allows something to rock up and down. Epi means upon. So these are kind of the bumps above the rockers, is basically what that means, the bumps above the rockers. Well, the rockers, the things that the other bones move against, are the capitulum and the trochlea. These are your condyles, these are your rockers. So the bumps above them are the epicondyles. Well, you know that the head of the humerus has got to be the medial side, okay, because it's the one facing your body. So the bump above this condyle on the medial side is the medial epicondyle. The bump above the trochlea, that condyle on the lateral side, is the lateral epicondyle. So condyle means rocker, epi means above, lateral means away from the body, medial means toward the body. So look at your humerus, look where your head is, you know the head's the medial side, you can figure out the medial and lateral epicondyles. Alright, so moving on down into your forearm. So your humerus was in your brachial region. Your next two bones, your radius and your ulna, are in your antebrachial or forearm region. And there's two bones there. And if you'll notice, in anatomical position, the radius and the ulna, right here if you blew it up, are parallel. That's why anatomical position is arms facing forward with your thumbs facing out. Once you turn your hand over, these bones actually cross. If you don't believe me, take your hand, cross your hand over, and you'll feel the radius and ulna actually cross. So the radius is going to be the lateral bone. The ulna is the medial bone. And people always get confused. They have a hard time remembering which one's which. It's really not that hard. The radius, if you were thinking about mathematics and you were going to measure a circle, what would you measure? And don't say diameter. You'd measure the radius. The radius has a circle on it. It's the only bone with this nice perfect circle on the very end of it. Okay, so that's the radius. The ulna starts with the letter U, and it makes this nice little U. So if you look at a bone that's got a U, that's the ulna. If it's got a circle, that's the radius. Okay? Now, the round part, the radius part, is the proximal end of it. The U is also the proximal end of the ulna. The other end is the distal end. Let's see what you got to learn about the ulna and the radius. Okay, so on the ulna, the other thing about the ulna, if you can't remember which one's lateral, which one's medial, take your hand, kind of bend your thumb out. It makes an R, or you can do that, make an R with your thumb. So the bone that's on the thumb side, the R side, is the radius. Okay, so you can remember it that way. So your radius is on your thumb side because your thumb makes an R. And I don't know why people just have a hard time remembering which one's which, so hopefully that will help you. Alright, some details you got to know about the ulna. You need to know the olecranon and the coronoid process. So the olecranon process is this area here, this kind of thick point here, and the coronoid process is the little sharp point here. So if you go back and you put the trochlea of the humerus into that groove, the olecranon process will fit into the olecranon fossa. The coronoid process will fit into the coronoid fossa. This little U area is called the semilunar notch or trochlear notch. So semilunar notch or trochlear notch. This is where the trochlea goes from the humerus. You have a styloid process. Remember, a stylus is something sharp like what you would write with. The ulna has a little sharp point at the distal end, and that's called the styloid process. And for some reason, I don't know why, nobody can tell me, the distal end of the ulna is called the head. So the distal end of the ulna is the head. The proximal end of the radius, the round part, is the head, and I don't know why. On the radius, all you have to know is the proximal end, which is that rounded head, and this little bump here called the radial tuberosity. Those are your features you need to know. So here's where we show the humerus and the ulna and the radia coming together at the elbow. Okay? And so basically the elbow doesn't just have one movement. You just don't do this with your elbow, right? You can do this, but you can also turn your elbow. Okay? You can pronate or turn your elbow over. And so that's why you have different joints here. The ulna and the trochlea, this joint allows you to do flexion and extension. Okay? Just a straight hinge movement. The radius, as it joins or articulates with this capitulum, that ball can kind of rotate around, the radius can rotate around that ball so that you can turn your hand over or pronate your hand. So that's the joint. So here's your coronoid process, and so when you bend your arm up, flex your arm, that coronoid process goes into that coronoid fossa of the humerus. On the back side of your elbow, the bony part of your elbow, that's the olecranon. When your arm is straight, the olecranon process goes into the olecranon fossa. And you can see the semilunar notch, the trochlear notch, the trochlea is kind of inside that trochlear notch. So that's how those work together. Alright, moving on down. We're down into the hands now. So what we're going to look at on the hand, this is a right hand. You're looking at a front side, anterior view, and a posterior view. And we're going to learn the carpals and the metacarpals and the phalanges. Your carpals, there are 16 of them, 8 in each hand. You do not have to learn the individual names of the carpals. I'm not going to make you identify the individual carpals. I just want you to know the carpals are your wrist bones. These are those little short bones that make up your wrist right here and articulate with your radius and your ulna. The radius is the big, at the distal end is the wide bone, so this is the radius, and then your ulna with the styloid process is the little more narrow bone. So most of the carpals articulate with the radius. Okay, that's where most of your carpals articulate with. You have 8 bones. Again, you don't have to worry about what you call them. If you're going to go into OTs, occupational therapy, physical therapy, x-ray technology, you may have to learn it, but not for me. Now, the next thing are your metacarpals. And people think these are your fingers. They're not. These bones, your metacarpals, make up your palm. So there's actually, it looks like fingers, but these are the bones of your palm called your metacarpals. And you have 5 of them. And then everything distal to the metacarpals, these are your fingers. These are your finger bones called your phalanges. Now, in order to name these bones, you have to be able to count, which hopefully you can do. And your thumb is always 1. So this will be the number 1 metacarpal. This will be the number 2 metacarpal, number 3 metacarpal, number 4 metacarpal, number 5 metacarpal of the right hand. Same thing on the left. The thumb is 1, 2, 3, 4, 5. So that's how you name your metacarpal. So if you see a picture on a test and I say name this bone, it would be the number 1, 2, 3 metacarpal of the left hand. Okay? Now, how do you name the fingers? You'll notice, actually it comes around here, sorry. Fingers to here. This is your thumb. The thumb is also called the pollex. So your thumb is also called the pollex. And you'll notice your fingers all have 3 bones. 1, 2, 3, 1, 2, 3, 1, 2, 3, except your thumb. It just has 2. Just 2 bones. Okay? So the way you would name it is you look at how far away it is from the trunk. Is it proximal or is it distal? So the bone that's closest to the trunk, the proximal one, this one will be your number 2 proximal phalanx. Phalanx is singular, phalanges is plural. This would be your number 3, and it's the middle one, middle phalanx. This would be number 5, distal phalanx. Okay? So on your thumb, you only have a proximal and a distal, no medial. There's just 2 bones in your thumb. And if you look at your fingers, you can figure that out. Your thumb just has 1 joint, and your fingers each have 2. So there's 3 bones there. So here's an actual bone, or actual hand. And so here's your radius. Okay, here's your ulna. Here are your carpals. Here's your thumb. Okay, so this is the number 1 metacarpal. number 2, 3, 4, 5. This is the number 1 proximal phalanx, number 1 distal phalanx, number 2 proximal phalanx, number 2 medial phalanx, number 3 distal phalanx. So just name them based on proximal, medial, distal, after 1, 2, 3, 4, and 5. Alright? Hopefully that made sense. Alright, so we have moved on through the arms. All we have left to do is the hips and the legs, and you will be just about through with all your bones. Good luck. Keep studying. I'll see you in the next video.